You are a GP, and a concerned mother brings her 2-week-old baby girl to your clinic. The mother reports that the baby has been difficult to breastfeed and seems to become lethargic during feeding. Your task is to take a focused history, perform a relevant physical examination, and discuss your differential diagnosis and initial management plan with the mother. Points to be addressed in history-taking feeding issues. The mother reports that the baby cannot breastfeed as well as expected and becomes lethargic during feeds. The duration of feeding is shorter than usual, though the mother is unsure of the exact time. Feeding difficulties have been present for the past week. The baby was feeding normally before this. Symptoms: no turning blue or pale during feeds, no rash or vesicles around or inside the mouth, no fever or discharge from the ears, nose, or throat, no issues with urination or bowel movements, but the mother noticed reduced urine output and dryness. Previously, the baby wet 5 to 6 nappies a day, but now only 2 nappies are wet. Bowel and urine habits: no smelly urine, but the baby seems drier than usual. Perinatal history: born at term through normal spontaneous vaginal delivery, NSVD. Birth weight was normal. No complications during delivery. No history of maternal infections during pregnancy. Immunizations are up to date. Family history: the baby's brother had a flu-like illness about a week ago. No one else in the family is currently unwell. Additional information: the mother believes she knows how to breastfeed, but feels the baby is not getting enough milk. Yellow discoloration over half of the trunk noticed during the week, with jaundice in the eyes but no change in urine color or stool. Points to be addressed in examination vitals: BP, 80 over 50 millimeters of mercury, HR, 180 beats per minute, regular temperature, 37.9 degrees Celsius, R, 18 breaths per minute, O2 saturation, 99%, signs of dehydration, dry mucosa, normal capillary refill, no reduced skin turgor, and full fontanelles. ENT examination: no discharge or redness, no vesicles. Respiratory examination: normal breath sounds, no basal crepitations. Cardiovascular examination: increased heart rate, no murmurs or other abnormal findings. Abdominal examination: no organomegaly or tenderness. Skin examination: yellowish discoloration over half of the trunk. Additional observations: jaundice noted in the sclerae, no lymphadenopathy. Differential diagnosis: primary diagnosis, neonatal jaundice, likely due to prolonged jaundice, possibly related to breastfeeding or underlying infection. Differentials: neonatal sepsis, given the history of lethargy, reduced feeding, and a sibling with a recent flu-like illness. Congenital heart disease. Although no cyanosis or murmur was noted, the elevated heart rate and feeding difficulties are concerning. Inborn errors of metabolism should be considered, especially with lethargy and jaundice. Hypothyroidism. Lethargy and jaundice could indicate hypothyroidism. Points to be addressed in ManageMNet. Immediate actions: arrange for urgent blood tests including bilirubin levels, full blood count, CRP, and blood cultures. Check glucose levels and consider urine microscopy and culture. Initiate phototherapy if bilirubin levels are elevated. Consider hospitalization for further monitoring and management, especially if sepsis is suspected. Counseling. Discuss the potential causes of the baby's symptoms with the mother, emphasizing the need for further testing and monitoring. Reassure the mother while explaining the seriousness of the symptoms, provide advice on feeding practices, and encourage frequent breastfeeding if safe to do so. Follow-up. Arrange for a follow-up appointment to monitor the baby's condition and review test results.